Hello friends, I'm Ansi John and I'm hereby inviting you to my presentation on the Nurse Leader Rounds. The mission of our organization, the Houston Methodist Sugar Land Hospital, is to provide high quality, cost-effective healthcare that delivers the best value to our patients in a spiritual environment of caring. I've been a nurse leader in this great organization for the past 13 years. As a charge nurse, my strategic goal towards achieving the mission of my organization is to conduct nurse leader rounds on patients to ensure that high quality care is provided by the staff each shift. Why am I doing this project? It's my commitment to help my organization achieve its mission. I'm also doing these rounds to ensure high quality patient care is being provided to our patients. By doing the nursing rounds, I can also get a chance to validate some of the best practices of nursing like bedside reporting and hourly rounding. Nurse leader rounds will also give me an opportunity to hold staff accountable for quality patient care. What are some of the benefits of the nurse leader rounds? By doing these rounds, I would help build relationship with the patients and their families. I can also identify changes in the patient's condition and help these patients improve their conditions by intervening promptly. By looking at the patients and their conditions, I can make appropriate assignments depending on the strengths of the nurses. I can also assess the environment for cleanliness. I can initiate service recovery programs. I can receive feedbacks firsthand from the patients and their families. Nurse leader rounds will also enhance transparency in patient care. What are some of the challenges I would face during my rounds? Nurse leader rounds would take time and it can't be done in a hurry. Also, these rounds will not be effective if patients are sleeping or they are hurting or they're angry or depressed. I can also be interrupted by phone calls. Staff can interrupt me asking for my help to attend patient emergencies. Also, patient and family problems will need to be met. Now, what is my plan how do I bring about my plan to working? My strategic goal will be achieved using John Carter's change management model. I would first create a sense of urgency for the leader rounds with all the stakeholders. Some of the stakeholders would be my nurse manager, the staff I work with, my PCAs, the Department of Case Management, my physicians, and all the other allied departments. I would then assemble a team to lead the change. I would create a vision of providing quality patient care. I would communicate that vision to all my stakeholders. I would then empower my team to take ownership of this goal and help me achieve this goal. I would consolidate improvements as the projects gets rolled in. And I also plan to celebrate short-term wins. And if this project becomes successful, I plan to institutionalize the change. What are some of the strategies I would undertake to conduct my plan? I would first communicate my plan clearly with the stakeholders. I would ask my manager's permission to conduct a mandatory staff meeting. In the staff meeting, I plan to present a PowerPoint. In my PowerPoint, I would include information that I will be collecting by making a literature review. So I would first conduct a literature review and see how different organizations have benefited from these nurse leader rounds. I would then send out a survey, a monkey survey, to all my staff and see what they think of these nurse leader rounds. I would include these data in my PowerPoint. And in my PowerPoint presentation, I also plan to include some of the questions I would be asking during my nurse leader rounds. The questions I intend to ask are as follows. I would first of all observe if the white communication board is being updated according to the plan of care of the patient. I would then observe if the patient's rooms are clean. I would ask the patients and their families if the staff are making hourly rounds and attending to all the pain, party, and the privacy needs of the patient. I would then ask questions if their discharge needs are being initiated. I would also ask if patients and families are taught on their medications and side effects. In this manner, I would try and cover up all the patient needs. And then, as I go along, I also plan to coach staff and do service recovery in a timely manner. I also plan to have weekly meetings with all my stakeholders and discuss the HCAHPS dashboards with them. My goal is to see an improvement in our patient satisfaction scores. So I would look into the dashboards of these patient satisfaction score every week and share this information with all my stakeholders. And if the project is successful, I plan to roll it over to the other units. Therefore, friends, implementing this best practice of nurse leader rounds will positively impact the culture of my organization. And I hope that those of you who are in the healthcare field would also implement these rounds in your institutions. Thank you.